Hi, everybody. My name is Dr. Jennifer Quammen. I am a practicing veterinarian, and I want to come to you to talk about what is a really big topic of conversation within veterinary medicine and beyond right now. And so this conversation is around the proposed mid-level position, an MLP, or what is sometimes called a veterinary practice associate or a VPA. And so why do we care about this? Why do I care about this? Why should you care about this? Well, this idea of a mid-level position is being brought over from the human side in terms of the way the structure of human medicine is. And it's said that this will be something akin to a nurse practitioner. And I think if you just hear that as a single statement, you're like, great, sounds lovely, let's move on. But I would love for you to hear more of the details of what this might actually entail and might actually mean for the animals that we as veterinary professionals take an oath to protect looks like. So there's currently one program that is on the books as a potential to train this mid-level person, and that is at Colorado State University. It's a 4-semester program. 3 of them are online and 1 of them is in person. And at the end of that time, this individual is proposed to be able to come out and do a lot of treatments and surgical procedures, including a spay. Now, if we again compare back to the nurse practitioners do not do surgery. And so this already is where the sort of similarities stop. But I want to tell you a little bit more about a spay. And I'm someone that does surgery most of the time in my professional career. And spays are not simple procedures. Many veterinarians never really get to a point where they love doing them. It takes a long time. It's a very complicated procedure. There's a lot of knowledge of anatomy that's important. And there are things that could go very wrong with a spay. And so I think the idea that we could train someone in less than half of the time that we're training a veterinarian to do the same procedure worries me in terms of the corners that are being cut. What does the process of the procedure look like? What does the pain control look like? There's a lot of questions in my mind about this. The proponents say we're doing this to improve access to care because there are patients, animals that are not receiving care, and I do think that is true. However, I think we already have a solution for that problem, and I might come back to that. But my initial plug is the solution is veterinary technicians and veterinary technician specialists, but we'll come back to that. If we talk about this VPA, there's a ballot initiative in Colorado right now, Proposition 129, that puts forth the opportunity for this to come into life in November based on what the voters in Colorado think. And the challenge here is, in addition to this person doing more or doing different things than what a nurse practitioner might be doing, they are not able to have liability coverage. And so if something goes wrong with the procedure, what recourse does the public have, as an individual? What's your recourse against this person? And that is quite limited. Who says what a national exam is going to look like for this person? There is no national exam. There is no state licensure. There is no way for us to ultimately regulate these folks. And I don't think we need to regulate everything to every single point. However, we do have regulation for veterinarians in every state in this country and in most states for veterinary technicians. Now, if I'm going to get on my soapbox is that I really think we should allow for credentialing of veterinary technicians in every state in this country. We still have 8 states where that's not a possibility yet. And I'm telling you, there are many forces at work fighting to make that happen, including our veterinarians and our veterinary technicians, because we stand together as one united team. And so I would love to see that we have a structure already in place in how we credential veterinarians and what we say their scope of work is. And that includes 4 things that are not within the scope of others: diagnosis, prognosis, surgery, and prescribing. Those are the 4 things that I have a privilege as a veterinarian to do that others in my profession do not. This VPA is going to be able to potentially do some of those things. And again, to do them essentially unchecked, because there is nothing to say what is their scope of work, what is their training, how do they get or are they required to have continuing education. None of those things are clarified at this point. So that concerns me when it comes to how our animals are going to be treated. And I do still think we need to talk about the workforce challenge. And I have really good news here is that we have an opportunity to already fix the workforce challenge with the workforce that we have. And what do I mean by that? Well, we have veterinary technicians and veterinary assistants, some of which are actually credentialed or have obtained a certificate program in many states that can actually do a lot of work under the supervision of a veterinarian. And so I think that if we were going to go down the path of how do we improve and deal with the challenges of workforce, I would say utilization of technicians, period. If we want to add some sub-bullets, I would say, yeah, utilization of assistants. And oh, by the way, veterinarians, quit doing the work that should be the work of your technicians and your assistants. That is something that they've trained for, they're capable of, and they're more than happy to do. And if they're not doing it, then they get frustrated and they leave the profession. And that is a challenge. We really need to step out of the way and let these folks do the work that they're trained for and they're comfortable with. We don't want to leave them hanging and never give support, but we also do want to be allowing people to step forth and really own their profession as well. And so I'm very much about validating and utilizing our technicians. And I think that's a great way for us to assess and maintain this workforce challenge. So if we get back to what are the cons of this concept around this veterinary practice associate, this VPA, another perspective I wanted to bring is what is the perspective of veterinary students right now? If you're a student and you're not knowing about this, you may not know about it at all. If you're at Colorado State, you're a student who's potentially going to be then training alongside or at the same time as this online person is training to do the same job as you or much of the same job as you. And that probably feels pretty deflating. I mean, I'm not a veterinary student at CSU. I don't know what that might feel like, but I think it's a little bit of a concern. And it also puts the students in an awkward position of, can they support this? Can they speak out against it? Are they asked their opinion? I don't know if any of those things are true, but I would be very curious. And so I think we have to stand strong as a profession. And within our profession includes those paraprofessionals, the veterinary technician or nurse, the veterinary assistant. You are an important part of what we do. The front desk team, the practice managers, you are all folks that we need as part of this profession. But particularly on the medical side, those of us that are delivering the care to animals, we have an obligation and a duty to care for those animals. I, as a veterinarian, take an oath. Those of you that are veterinarians took this oath as well, and that includes alleviating pain and suffering. It includes promotion and protection of public health. I'm here to tell you that if I weren't talking about this and telling you that mid-level is a bad idea and you should be opposed to it, that I would be going against my oath as a veterinarian. And so I'm here to stand strong and stand proud with other veterinarians, with veterinary technicians, with our veterinary technician and veterinary students, and those of you that want to learn how to develop your skills even more as veterinary technician specialists. Those are people who are already veterinary technicians and have learned more about one specific facet of the industry. So, for example, anesthesia, right? We have technicians who probably do better anesthesia and know more of the nuts and bolts than I might as a veterinarian, and I'm going to rely on them. This is a team that I have already at my fingertips, and you better believe I'm going to use them. And so, why did I feel empowered to come and talk to you about this? Well, again, as a veterinarian, this might impact me, but that's not really my worry. My worry is, what does this do for patients at the end of the day? If an animal is harmed, what is the recourse for that? Who can be held responsible for that? This person has no obligation and no way to be regulated at this point. And so that's a worry for me. I also want you to know that there are a lot of veterinary groups that have come out in opposition to this position around a mid-level. The American Veterinary Medical Association has come out in opposition. The American Association of Equine Practitioners, the American Association of Bovine Practitioners, the American Association of Swine Veterinarians. And those are a lot of people that represent a lot of veterinarians in this country, have all come out against this. The veterinary management groups, They have come out and said, we're in opposition to this. Our national licensing group, so the American Association of Veterinary State Boards, is not a proponent of the mid-level position, according to a statement they've made. And so the other group who's just come out and said this in the last, really, quite honestly, 24 hours, is our student AVMA. So the American Veterinary Medical Association has about 105,000 members, and SAVMA, or the student AVMA, has about 20,000 members. Those 20,000 students have a united conversation and said their leadership team has come out and said, we are also not in support of this mid-level position. And you can ask them their individual reasons why. I've told you my individual reasons why, and the most important one for me is that this is going to harm animals and this is going to harm people. And I think this is a bad idea. I think it's not thought out well enough, and I think we already have a solution at hand. And so why are we reinventing the wheel with something that is probably going to be a very bad decision and really going to change the way the veterinary profession looks? There are things about human healthcare that I really envy as a veterinarian, and there are things about human healthcare that I'm like, I think I'm okay with how we do things in vet med. And I don't think we need to be the same. But I do think we need to think about what are the differences in how I practice medicine as a veterinarian and how my technicians or nurses practice. And I think it's important that they have supervision, and I'm here to provide that supervision along with other veterinarians. And I think that I hope you will think about sharing this with folks that you know in Colorado and beyond. If they're aware of Proposition 129, I would like them to vote no. I think you should be in non-support of this. If you care about animals and you care about protecting and promoting public health, you should stand aligned with other veterinary professionals, including our technicians, including our veterinarians, and including our veterinary students. And so with that, I'll sign off. I know it's a long conversation. I'm sure there will be some feedback, and I'm happy to hear it. But if there are questions, I'm more than happy to answer those as well. So with that, my name is Dr. Jennifer Quammen. I am a veterinarian. I am a previously, now inactive licensed veterinary technician. I know a lot about this topic, and I hope you've learned a little bit more about it yourself, and you can now formulate an opinion that is much more robust. So thanks so much. Have a wonderful rest of your day, and I can't wait to hear and see where this conversation goes.